Good morning. This is Latanya. How are you? Everyone here?
Good morning, Dr. A. Your audio is a little bit muffled, a little bit distant.
Okay, hold on one second. How is that?
That is much better, thank you. And now that everyone's here, I can go ahead and introduce the call. Good morning, everyone. Thank you for joining us for our housing call this morning. Without further ado, I will go ahead and turn it over to our Director of Housing Policy, Stephanie Watkins-Cruz.
Good morning, everyone. I hope you are having a great week so far. I'm really excited for today's call, so we're just going to go ahead and jump in. First, I want to mention some organizational updates. Make sure you save the date for our Bringing It Home conference. That it will be June 4th through the 5th. Our Bringing It Home conference, Ending Homelessness in North Carolina, will be at the McKimmick Center in Raleigh. And for the first time since 2019, we will be back in person to learn and network and collaborate with industry experts from across North Carolina and beyond. This conference is hosted by the North Carolina Housing Coalition, the North Carolina Coalition to End Homelessness, as well as the North Carolina Department of Health and Human Services ESG office. So keep a lookout for additional updates. Registration will open in March. Without further ado, today is a special call. We are focusing today on the 2024 point in time count and talking a bit with two amazing experts and practitioners in the field of homelessness in North Carolina. So I will go ahead and introduce them. We'll start with Dr. Latanya Agard. Dr. A. She is the Executive Director of the North Carolina Coalition to End Homelessness, and she comes to the coalition with a wealth of leadership experience within the faith community, higher education, nonprofits, as well as mental health. She holds several degrees, including a BS in chemistry and a master's in English from the University of Alabama, as well as a master's in divinity from Duke University Divinity School, and she is a doctor of ministry from Louisville Presbyterian Theological Seminary. Her work in higher education focused on mentoring first-generation African-American students, helping them to build their capacity for resilience, and she also taught at the University of Alabama, Miles College, Barton College, and Duke Divinity School. As a local pastor and church planner, she has led communities of faith to consider the dynamic relationships between Christian practices and professions of faith. And this transformative work is part of what fuels her interest in connecting the tenets of her faith with the practical needs of marginalized communities, which is partly reflected in her work to help establish One Wake, an IAS affiliate in Wake County, North Carolina, her job as a case manager for the Support Circle program for homeless families, and her service on nonprofit boards of directors. You can read the rest of her bio in the summary blog that we'll release after this call. But I want to go ahead and also introduce our second wonderful speaker, Rachel Waltz. She is a manager at the Orange County Partnership to End Homelessness. She is a licensed clinical social worker with over 15 years of experience providing community-based mental health and housing-focused interventions in partnership with individuals, organizations, and communities. She served as a manager of the Orange County Partnership to End Homelessness since 2021, and the partnership, a little background, is funded by the towns of Scarborough, Chapel Hill, and Hillsborough, as well as Orange County, and serves as the Chapel Hill-Orange County Continuum of Care. I'll let her tell you a little bit more about her organization. But prior to joining the Orange County Partnership to End Homelessness, Rachel worked in community mental health at the UNC School of Medicine and at the Durham and Bronx Veteran Administration, providing care to veterans experiencing homelessness. She earned a master's in social work from Columbia University, a bachelor's in criminal justice and psychology from the University of Delaware. She's a proud social worker who lives with her wife and son in Durham. So without further ado, I will go ahead and ask both of our participants. Let's go ahead and start with Dr. A. Dr. A, can you tell us a little bit about the North Carolina Coalition to End Homelessness?
Yes, good morning. Thank you for inviting me to the call. The North Carolina Coalition to End Homelessness, the acronym NCCEH, is a coalition of individuals, organizations, and community partners working around the critical issue of ending homelessness across the state of North Carolina. Our agency is also the lead agency administering the North Carolina Balance of State Continuum of Care. We house a data center that is responsible for collating, analyzing data, producing reports, and sending information to HUD through our homeless management information system. We also have the SOAR lead for North Carolina here at our agency, and our goal is to continue to collaborate and develop key relationships to advocate for more funding, more housing, and laws that continue to improve the lives of those who are unhoused and unsheltered. I hope that's enough.
Thank you so much. Yeah, no, absolutely.
Yeah.
Rachel, could you tell us a little bit about the Orange County Partnership to End Homelessness?
Absolutely. And again, thank you for the invitation and really appreciate the work of the North Carolina Housing Coalition. The Orange County Partnership to End Homelessness, or OCPEH, serves as the continuum of care for the Chapel Hill Orange County Continuum of Care. It's one of the 12 COCs operating here in North Carolina. OCPEH is a diverse coalition of service providers, local governments, community members, and people with lived expertise of homelessness, working together to coordinate funding, share best practice approaches, amplify community priorities and needs, and end homelessness across Orange County. In addition to ensuring an equitable and systematic approach to addressing the experiences of homelessness, OCPEH also provides direct services to address the 3 pillars that are needed to find and maintain permanent housing. Housing that's affordable, having adequate supports in place, and having enough income. The work of the partnership here includes coordinated entry, street outreach, rapid rehousing, planning for inclement weather, as well as SOAR, which Dr. A just mentioned.
Wonderful. Thank you both so much. So one of the reasons why I invited you all to join our call this morning is because recently, I believe at the end of 2023, HUD released the Annual Housing Assessment Report, or the AHAR. Part 1 of that report that provides an overall assessment, a HUD report, if you will, to Congress with nationwide estimates of homelessness, as well as demographics and different things like that. And also this week, particularly this month, is really important, and I think in the field of homelessness and in that policy area, because a lot of communities are gearing up to do the point-in-time count. But I want to ask you, Dr. A, what stands out to you, or what trends stood out to you when you looked at the latest Part 1 2023 report that was released?
Thanks for that prompt. I was first struck by the increase in homelessness in just about every category across the nation over the last year. When I thought about that, I thought about the fact that the additional funds and protections that were enacted at the peak of COVID, so we had more money available, and I think more creativity, and there was an urgency to keep people housed and to provide additional support resources. But many of those have been discontinued, and more families, as we saw in that report, are finding themselves in unstable housing or unsheltered across the nation and in North Carolina. And I believe in North Carolina we also saw a spike in homelessness rates. And I believe that, what we should remember is that these numbers remind us that intentional targeted programs that were implemented during COVID, housing first programs that were supported in other ways, renters protections against evictions, these things can and do work if we have the political and the moral will to act on behalf with and in solidarity with people who are experiencing homelessness.
Wonderful, thank you. Rachel, I'll ask you, and feel free to add anything else that stood out to you about the report, but I wanted to ask you, could you tell us about what the point-in-time count is and why does it matter to your work?
Yeah, absolutely. So the point-in-time count is one of the 4 reports that are required by HUD that go up and generate the AHAR annual homelessness assessment report that goes up to Congress. And that really drives home for our elected officials the state of the need, as well as really generates the funding that comes back down to the local level. And so the PIT count is a head-by-head count of people who are experiencing literal homelessness in each community across the country. This count is typically held in the last 10 days of January to ensure that continuums of care are counting every single person who is living in sheltered and unsheltered settings. And while there may be concerns about conducting the count on what is typically one of the coldest nights of the year, the snapshot of homelessness can really be helpful in a number of ways. First, it can really provide, relatively consistent data about subpopulations and demographic shifts year over year. We certainly see this reflected in experiences of inequities in our systems and the overrepresentation of Black and African American folks experiencing homelessness pretty consistently in every community across the country. It also can really include the ability to highlight the needs for greater numbers of housing resources like emergency shelter for folks newly experiencing homelessness and permanent housing solutions, really the ultimate goal. Additionally, the PIT count can also provide an opportunity to connect folks who are experiencing homelessness with additional services or resources, specifically by having such a kind of targeted and collaborative approach, oftentimes utilizing volunteers and a cross-section of stakeholders. We can really identify folks who homeless service providers may not typically come into contact with. And then finally, you can also use the point-in-time count as an opportunity to really solicit input from people who are currently experiencing homelessness in our communities. So for example, in Orange County, starting last year, we started soliciting input through the PIT count on our homeless system gaps. And new in 2024, we're going to be inquiring about healthcare access following last year's Medicaid expansion.
Wonderful. Definitely a critical time and really pivotal to y'all's work. Thank you for that breakdown. I want to ask you both, how could people listening or interested be a part of the point-in-time count and or engage with your organization's work? And I'll let Dr. A start with this one.
Thanks so much. In short, people who want to volunteer or support the PIT count or other initiatives to end homelessness, the first thing they can do, I believe, would be to contact their county's continuum of care to see if there is some initiative broadly, even beyond the PIT count, where they can be trained to volunteer or provide some other kind of maybe administrative assistance during this very busy time of the year. In addition to that, they can, of course, go to maybe some of their local partners providing direct services. Of course, there are soup kitchens, there are places that provide blankets and clothing, and of course, there are shelters. So there are many ways, but the key is to make the call and to show up and to get involved.
And Rachel, how can people engage with this issue and your organization's work?
Yeah, great question. Definitely want to echo what Dr. A just said. Also really want to highlight that the work of outreaching people who are experiencing homelessness and supporting local initiatives to end homelessness doesn't stop on PIT night, January 25th. This work is a day in, day out job. And every community is a little bit different, and so that's where it's really critical to key into your local continuum of care to find out what the local needs are. And you can learn more about both what's available, but also what's not available by checking out your community's homeless system gaps analysis, and then working with local providers and your COC to figure out how to plug into those existing system gaps.
Wonderful. Thank you both so much for joining us today. I really appreciate it. Everyone listening in, we will have their full bios as part of the call notes, as well as part of a blog that will summarize some of the highlights of the latest 2023 AHAR report. So thank you both again for joining us. We're going to go ahead and move on to federal updates. This is going to be a blitz update call, so I'm going to breeze through several of these. We have averted another shutdown for now. I feel like we all need to get those on T-shirts because we've now averted 3 different times since last fall where we could have experienced a government shutdown. I want to highlight in particular that the National Low-Income Housing Coalition is having a day of action this Thursday, January 25th, in order to demand increased funding for HUD in the final fiscal year 24 spending bill. This has been a consistent act, and it needs to really be, we really need this extra sort of momentum to continue asking our members of Congress to demand increased funding for HUD. Because unfortunately, any sort of flat treatment, and there's not enough increase, that will result in essentially a budget cut for HUD due to the rise in the cost of housing and the cost of administering housing programs. There's a toolkit from the National Income Housing Coalition that you can use that we'll link in the call notes. Please participate and make sure that you check that out. Additionally, the Ways and Means Committee cleared the way for a tax package that does include some tax provisions that would expand parts of the Affordable Housing Credit Improvement Act. So we've added a statement about that in our call notes as well. There's some opportunities to engage with HUD around proposed CDBG, which is Community Development Block Grant Program changes. And so there's a press release, the proposed rule, which is the first time they're thinking of doing any sort of substantive change to this program in almost 30 years, and then a chance to submit a comment through March 11. So that's for proposed CDBG program changes. And then there's also a listening session for tenants regarding the proposed rule to provide 30-day notice before initiating eviction proceedings for non-payment of rent. Moving on to state updates. As you all know, we're following the insurance issue very closely. Earlier this year, the North Carolina Rate Bureau proposed rate increases for the entire state of North Carolina, averaging around 42.4%, but in some parts of our state, like around on the coast, some counties are the rate being proposed is an increase of 99.4%. So pretty impactful. I had the opportunity to listen to some of the feedback yesterday during the virtual part of the listening session that was held, and people are quite upset. So in the call notes, we'll have a few things for you. We have a form because we want to make sure that we collect stories and examples about how this insurance premium increase would impact you, your community, and your business, because we know that this proposal is going to have widespread impact. And we want to be able to share real stories and connect the dots and continue advocating alongside you all. We also recommend that you all continue to send in your public comments. Emailed public comments have to be sent by February 2nd, as well as written public comments. I've included both the email and the address to send those comments to, as well as a detailed list by cities and counties for the requested increases. And then I also want to highlight that AARP has also launched advocacy efforts against this. So I've linked their advocacy efforts in our call notes as well. Moving on to state updates, the North Carolina General Assembly will convene again on February 14th, but they are having committee meetings. There's one today. Actually, it just started. The Joint Legislative Commission on Governmental Operations Subcommittee on Hurricane Recovery and Response. Tomorrow will be the House Select Committee on Homeowners Association, and then next week, the Joint Legislative Oversight Committee on General Government. Local communities, a few cool ones that I want to list up for you. Buncombe County released an RFI opportunity. It's in the process of developing plans to incentivize the conversion of short-term rental units within Buncombe County to affordable rental units serving 80% of the AMI or below for a minimum of 12-month leases. This request for information, RFI, is intended to collect information and recommendations regarding the creation of such an incentive program. So check out the call notes for additional details. We've linked both the RFI opportunity as well as some details about next steps because there will be a public hearing on the matter next month. Cities across North Carolina are looking for ways to expand the housing supply through changes to planning and zoning regulations that promote density. So we've linked a few examples from Cary, Charlotte, Winston-Salem, as well as Raleigh. Moving on to resources and reports. We have a few from the Joint Center of Housing Studies. They've been on a roll already this year. There is a report indicating that homeowner mobility is stalling amid the rising interest rates. Of course, homeowners or interested homeowners and current homeowners are feeling pretty stuck, and so that is starting to come across in the data. And the Turner Center created a tool. I think it's pretty cool. It might be a little nerdy, but it's called Demystifying Development Math. So it's a really helpful tool that kind of takes you through what it means and what it takes for a project to actually pencil out. Last but not least, a few events and things in the news that I want to list up. The live stream report release of the America's Rental Housing 2024, so the State of America's Rental Housing, will be this Thursday, January 25th at 4 p.m., hosted by the Joint Center for Housing Studies of Harvard University. And then the Urban Institute on February 5th will be having a webinar from 3:30 to 5 p.m. About zoning reforms that improve access to housing for all, evidence and lessons for advocates. So that seems like it's going to be really promising. And the in the news piece that I want to lift up, because I have been hearing a lot more about this, is a piece from North Carolina Newsline titled Homeowner Angst, North Carolina Lawmakers Urge to Address the Growing HOA Complaint. I recently had the privilege of speaking in Winterville, North Carolina, and Pitt County, and I heard a young woman's testimony, honestly, about how after owning her home outright for 15 years and moving into her home when there was no HOA, she learned last year that there is an HOA, and they've sold her house. And so these stories like this and stories across the state are popping up again and again and again. So I know I'll be paying more attention to this issue, but I think a lot of the issue has already been kind of shared with legislators. They've created a House Select Committee about housing homeowners associations. And so this is definitely something that we're trying to keep an eye on. Thank you all so much for joining us today and joining us for this slightly extended call. Don't forget to check out the call notes on our website. We have a lot more that I didn't go through. Thank you again for all that you do and for supporting our advocacy efforts, for sharing your stories with us. And as always, if you need anything, don't hesitate to reach out. I hope you have a great rest of your week, and we'll talk to you next time.